Super Health Ambassador. The next mission is to discover why infant mortality is a disparity affecting Davidson County. You have a daunting task. Find out how the community is affected by the issue of infant mortality. Are you up to the challenge?
Of course, Mr. Universe.
As a valiant in this county, and it's your job as Super Health Ambassadors to bring justice to Davidson County. Just think of the thousands of babies that you will save in your efforts. Good luck.
But wait!
Historic. Black. Collegiate. Survey your peers. Find out how they feel about this issue.
Hi, my name's Historic. Can I ask you a few questions about preconception health?
Sure.
You must speak with the community and find out how this issue is affecting Davidson County.
I'm Mr. Black. What do you know about infant mortality?
Dr. Kim is an old friend of mine and an expert on the matter. She'll be arriving there later to discuss some suggestions and solutions for Davidson County.
Oh,
Dr. White Etheridge. I'm collegiate.
you can call me Dr. Kim.
Let's have this talk.
Okay.
What is infant mortality?
Well, infant mortality is the death of a baby before it reaches its first birthday. Well, it's really scary to think that there are areas in our city that actually have infant mortality rates that are equivalent to those in a third world country. For example, in North Nashville, the infant mortality rate is almost 1 in 50. So 1 out of every 50 babies born will die before its first birthday.
Are you aware of the impact of infant mortality in Davidson County?
I do know that in Davidson County, the infant mortality rates for Blacks tend to be 2 to 3 times higher than in the white community.
Do you plan on having children?
Yes, I do.
I do.
Yes.
How are you actively practicing preconception health in your everyday life?
What exactly does that mean?
I take a folic acid.
You mean as in eating healthy and making sure my body's taken care of in preparation for possibly?
Yes.
What is the #1 cause of infant mortality?
Well, actually, the #1 cause of infant mortality has to do with birth defects. But after birth defect, it's all about the health of mom. If you have a chronic disease like diabetes, high blood pressure, or something like that, and it's not controlled prior to pregnancy, you put yourself and your baby at risk for having a poor outcome.
Why is there a disparity of infant mortality in the Davidson County area?
We understand that a lot of women in the African American community, especially in that area, do not go to their prenatal visits.
You're already behind on the prenatal visits.
We have a lot of women who, abuse drugs and tobacco and still do throughout their pregnancy.
I believe lack of education as well as just not having that support system.
Even the transportation, just getting around to and from the doctor.
Feeding children at 3 months old cereal.
Do you exercise 3 times a week?
Yes.
I don't.
On purpose? No.
I do not.
How can we practically prevent infant mortality?
Well, probably the best thing we can do is to encourage young people to be healthy now so that later on when they're ready to have a family, they're in good preconception health.
What advice would you give to young couples who plan on having kids?
Taking care of your body. If you have any pre-existing medical conditions, getting that under control. Taking your 400 micrograms of folic acid and just, in general, just taking care of yourself.
Right. Do you have any kids?
Yes, I have a soon-to-be 2-year-old. Yeah, I have a little girl, yes.
Now, did you plan for those children?
No, I did not. I did not. It was definitely an unplanned pregnancy going into my senior year at Fisk University.
How does unplanned pregnancy relate to infant mortality rates?
Well, we all should make sure that we're in the absolute best health that we can be prior to pregnancy. And if the pregnancy is unplanned, then you don't always have time to make sure that you've done that.
When you engage in sexual activities, do you use contraceptives?
Absolutely.
Condoms?
Yes.
Yes. Safe sex.
Thanks. If you plan on having children, practice preconception health now. Diet, exercise, use contraceptives. Mr. Universe, mission completed.
Always remember to be aware of the things that you do to your bodies. For men, and especially women of childbearing age, an unplanned pregnancy can result in an unhealthy outcome.
Talk to an expert in your community. Find out how you can get involved and join the fight against infant mortality.
Practice preconception health now.
Plan and prepare for the health of your child.
Be responsible and share this message.